Bienvenidos a Generación Latina, your host here, Carolina Pena. And tonight I want to introduce you to a national leader. We have the honor of being here with David Pena. I want to say David Pena in Spanish, of course. Now, note this, we are not related. David has a great story, just of an up-and-coming national leader, and his background being born in Texas will give us kind of a different taste for what we normally see here on the studio. But he's here now in Washington, D.C., heading up the Hispanic Dental Association. So many of you who might consider dentistry as a profession or as being an oral health professional, I think I want you to listen to some of the resources he's going to share, but more importantly, what he is about. The story of an immigrant like many of us and our parents, and becoming somebody not only educated but in leadership, and leading many students and organizations that I think will give us a sense for what it's like to be in his shoes, what it's like coming from a very small town in Texas and making it to Washington, D.C. So, David, muchas gracias. Thanks for joining us.
Thank you. It's a pleasure to be here.
So, David, tell us a little bit about yourself. What's your background? What was it like growing up in Texas?
I'm originally from South Texas, and so I've been on a national journey to get to D.C. My family is a family of farm workers in South Texas. We migrated to North Texas and Kansas over the years, and that's actually what got me to college, because I went through the College Assistant Migrant Program, which is a scholarship program for first-generation migrant students. And so that's how I ended up in college, and that really is what opened the doors for me.
So it's interesting because a lot of the Latino youth in our area, don't really have that kind of experience of, growing up in a migrant working family. What is that like, just to begin with?
I mean, it's all we knew. And so as a teenager or preteen, it was sort of the excitement of getting out of school and getting a truck, all the family, to move up north to go work in the fields. So we'd work in cotton fields, we'd clean up fields, we'd different areas of North Texas and in Kansas, and then we'd return in August just in time for school. So it was sort of our little vacation, but it was also what solidified as a family unit working together and making enough money for the remaining part of the year when we return back to our home. And actually my parents and my grandparents have all worked in the same area, many times working for the same individuals in the same family. So we're a multi-generational farm worker family.
Very cool. So now I know this is really the reality for hundreds, who knows, maybe millions of Hispanic families, mostly out west and in the south. Is it common for a young Latino growing up in a migrant family to go to college or even finish high school?
It isn't common, and a lot of it is the different families sometimes leave depending and follow the crop. So some of the families that go to California and follow to Oregon and follow the north. So we were in some ways lucky that our migration was only for about 4 or 5 months. And so a lot of times it does affect adversely a lot of migrant students because they're taken out of school early. They're put in a different school, so the adjustment period is harder. So it is that much harder for migrant students or students from migrant families to get into college because, one, they usually fall behind in education, and so there's not the sort of continuity in education. Sometimes they don't graduate because they've been behind a couple of years, or they've had to be the provider in the family and lead the family of farm workers. So in many ways, yes, we were a migrant family, but we had sort of the opportunity that our family felt that education was important, and so we'd migrate and then be home in time to, at the very minimum, be late and start school, but also be part of the start of the school year.
So give me an idea, 16, 17-year-old David, what are you thinking you're going to do the rest of your life?
Well, what's really interesting, I usually get the question of, what did you want to do? What was your career choice? And I think when I was a teenager, all I wanted to do was something different. I could see through being in school and some extracurricular activities that I'd been in competitions, I knew that there was more to being, and education was going to be that catalyst. And so for me, it was really about wanting to do something different. Nobody in my family had been to college, so there wasn't sort of that, a mentor that could tell me this is what you do. And I actually ended up by chance, we were helping our counselor move his office from one end of the building to the other. And I was helping, and I saw a brochure that there was a scholarship program for migrant students. And so I applied for the program. And the university that I attended, St. Edward's University, is one of the few universities in the country that actually has a program it's called the College Assistant Migrant Program, which is CAMP. It's a 4-year scholarship program for students, and it's not only a scholarship program, but there's a support effort with the university supporting the students and our success. And so I'm very grateful for that program because it really did change my life.
Yeah, you mentioned this program was a scholarship, but it also provided like tutoring and just kind of the whole environment that you needed to succeed, given that you maybe did not have the opportunities that many other students could have had.
Absolutely.
Yeah.
And that was essential to my success at the university, because having come from a small town, going to a major city, not having the sort of the influence of someone who had gone to college, so being a first generation, being away from the family, all those were challenges that I had to overcome, but the sort of family network structure that the university created for college students was really part of what changed my life.
That's awesome. And it's something that we take for granted. In this county here, Montgomery County, and really in many other places in the United States, there's just kind of a growing awareness that a lot of undocumented students need that kind of support, that the one that you receive, for example. So I'm really excited that I know, at least here in Montgomery County, we recognize, Montgomery College has made has taken huge steps to recognize the value in undocumented students and also their inability to pay up for college. So I know that we're doing a lot, and we definitely hope to see more. But one of the things I wanted to ask you, so once you get to college, and I mean, did you think you'd be like a big industry farmer since you'd been all around farming, or what sort of, what went next?
Well, what I was fortunate about also was that the university is a liberal arts university, so I got to take a lot of courses that sort of gave me the opportunity to look at what was out there. I also was able to get an internship through the university at the legislature, so it sort of exposed me, and Austin being the capital of Texas also, where the legislature, to be an intern at the Capitol, to see how the political process works. And so I was able to sort of determine what career path that I want. And I chose political science. And so that was really, for being in Austin at that university, studying political science, was really for me just the catalyst to really change where I wanted to be and give me the opportunity to look at different paths. And that's the path I chose, to major in political science.
So what's cool is that when I know about you, I mean, you've gotten to, have your hands in both business, government, nonprofits. You've dealt with huge national organizations, and currently you are the leader of one. And so you've gotten kind of a sense and feel for all of these types of organizations that are all around us in society. So what sort of unique perspective have you been able to gain, seeing all these industries and sectors? Like I just think you have such a diverse perspective, which is really cool, and you're a young, rising Latino, a national leader. So what would you give us?
I think you are a combination of your experiences, and so not only having been a migrant and living in different cities, but also the exposure at the liberal arts university, what I was able to see, what was the opportunity. And so as you've sort of alluded to, I owned my own business and went that route. I'm a small business owner, entrepreneur. Then I worked for government, sort of trying to tie back the political science aspect, and then ended up in nonprofits. And that's really been, for 16 years, I've managed nonprofits, and that's really been my passion. And it's really tied to helping the Latino community and giving back, because I've seen how education can change a life, how mentorship can change a life. And so I think that leading a charitable organization specifically that helps the Latino community can be impactful, and one person can make a difference, and I hope that I'm making that difference.
Certainly. What has been, in all these years, would you say the biggest challenge you've had to overcome? Granted, getting to college was huge, but for you?
The biggest challenge for me has been being away from the family. So as most Latinos, we grew up in a very tight-knit community, and so you're with your tias, your tios, your cousins, your family, your brothers, and so wanting a sort of broader path and sort of trying to seek those opportunities. A lot of times those opportunities aren't in the small communities that we come from. And so that's been the biggest challenge, as sort of being away from the family, seeking a career path. But there can be a balance, and especially nowadays with technology and sort of, I set up my mom with Skype, and so we can talk. And so there's that connection. My nieces and my nephews are more, computer savvy, and so we're connected. But that's probably been the biggest challenge, is just being away from your family when you're seeking those career opportunities in the larger cities or where the national organizations are, has been the biggest challenge for me.
That is such an interesting perspective, because I know, as I was pursuing my own career dreams, I would often ask all the people that that had these amazing careers in, let's say, journalism or all kinds of things. I would always ask them, what's been kind of the one thing you'd have to sacrifice to have had the great career you have? And oftentimes they would say family. Mm-hmm. And that, just gave me enough information to know I would not want to end up where they are because I have my own values. But mm-hmm. I think it's really important for anybody to know just what is the cost of pursuing that dream. Is it something you're willing to do it? And all the other ways that you can sort of make it work, make work whatever you feel you may lose, right? And maybe not seeing your mom every weekend, but at least in staying in touch. And I think that I'm glad you bring that up, because we do need to be aware, and we need to be asking people that we meet constantly, what kind of sacrifice have you had to have or make mm-hmm. to have the career you have. So I know, you've dealt with a lot of students, and before we go into our next segment about, specifically what you're doing now with Hispanic Dental Association, just kind of give us from all the students you've dealt with, I'm sure, you've given tons of really great advice, but if you could give sort of one solid, piece of advice from your own personal experience, what would it be?
I'd say build a network. And it's not only a personal network, a business network, but also just a broader network of individuals that can be your mentors, can be a resource, because it's important to balance out yourself when you're seeking a career, when you've arrived in some ways in that career that you're sought out. But at the same time, there's actually going to be a point in your life that you now say, okay, I have my network, I want to be part of someone else's network that is coming up, so you can make that difference. So having a network and staying connected to that network. And a lot of ways now, technology is that conduit to staying connected. So whether it's an email of how you doing, an email of can I help you, is there a project, a congratulations, great job.
Not just LinkedIn then.
Yeah, not just LinkedIn and saying that, I've got a broader network. It's actually staying connected with people and what they're doing, how you can be helpful, how can you be resourceful, because those are the individuals that if you ever need, and even if you don't need, it's a good way to sort of just stay connected with what's going on around you, the broader community, but also stay connected with where you came from and also where you're going.
Absolutely. That is so true. And I think that's how we connected, through
Absolutely.
Somebody in our mutual network, and I think, it's been really great. I often tell, students, of all the jobs that I've had, I think I've only had to apply to one. Everything else has been because of my network. And so it's absolutely the way to go. Of course, it's all about who you know. But more than that, it's also about who you help.
Correct.
So I believe that, and yeah, thank you. We're going to keep talking about this, and also, like I said, how I'm helping him as well with the Hispanic Dental Association. So stay with us. We will be right back. Back here in Generación Latina, we're talking about Hispanic oral health with the national leader of the Hispanic Dental Association, David Pena. Thank you for joining us.
Thank you.
And well, I wanted just to ask you, I mean, what the work that you're doing now, it's kind of on a whole different, I mean, not a whole different level, but I mean, you're not a dentist, right? And you know what I did bring? I brought my toothbrush. Not my, it's not you, so you can hold it as a little prop. But you know what? Hispanics in oral health, like, what is HDA about?
We're the Hispanic Dental Association. For over 23 years, we've provided service, education, advocacy, and leadership, not only for our members, for the broader Latino community. It's been the goal of our board of directors for several years to transition to Washington, D.C. So that reality is here now. We've opened an office in Washington, D.C., which has given us the opportunity to advocate for oral health, to visit with not only senators and congressmen, but other Latino leaders that are involved in not only the Latino health, oral health, and other aspects of our community. And so we're excited to be in Washington, D.C.
That's a big step, I mean, for any organization to move their headquarters to D.C. And you're definitely, you know, now with the big players, so it's exciting. But now the organization is nationwide.
Correct.
So what are we looking at here in terms of how many people, like just how many people are involved? What kind? I mean, is it only for dentists, or what's up?
What's great about our organization is, or what's unique also, is that even though we're the Hispanic Dental Association, we represent dentists, oral hygienists, dental assistants, and students who are currently in dental school studying to be dentists. So that's the exciting part about we have a broad sector of our members. We have 9 chapters in cities across the country. We have 31 collegiate chapters of students who are studying to be dentists. So those are all our members who not only are part of our organization, but also provide services to the individual communities where they belong, whether it be by health fairs, whether it be by volunteering at events or outreach to middle schools and high schools, talking about the importance of oral health. So that's really our reach deep down into the communities, and many of our members are in communities that have the greatest need. One of the biggest numbers that is not only troubling, but it's also sort of the guiding, is that 45% of Latinos don't have dental insurance. So we want to be part of the dialogue in Washington right now, that Washington is having the dialogue on health. And we want to be able to say not only health is important, but oral health needs to be part of that dialogue. And so that's why, the biggest reason of why we're here in Washington, to be part of those conversations.
What's so interesting is that I think most people don't realize that dental health is really so important. Like if you have a dental toothache, I mean, that's something that can't wait, you know, and oftentimes, you know, it's through your dentist that you find out about so many other health problems that, you know, that we struggle in our community, especially diabetes. So that's sort of what's interesting to me, and what I didn't realize before is that our oral health plays kind of a huge part in our overall health.
Absolutely, and there's a statistic that 30% of Latinos think that with brushing that's enough, and that they don't have to go to a dentist. But what's important also about oral health is the inequalities and access to care. Because a lot of times it's about educating our community about the importance, but also access to that care. A lot of times Latinos live in communities where there's a lack of dentists. A lot of times they live in communities where the dental services aren't free, and so if they don't have insurance, they don't have access. There's a balance between families having to decide to say, do we put food on our table, or do we buy a toothbrush and toothpaste? And so those are the things that the Latino community, as the broader community, also grapple with. And so we are here to advocate for access, but part of that is educating. And so a lot of our members, through their dental practices, through being professors at dental schools, provide that education and outreach to the community of the importance of oral health, and as you indicated, how it affects the overall body, and how indicators of how what's happening in your mouth indicate, you know, on symptoms of diabetes, of heart disease, or our precursors. And so that's why it's important to be educated and to know these things.
Mm-hmm. Now, all right, so let's say I'm a dental student, or maybe thinking about a career in dentistry. How can I get connected with your organization? Are there a local chapter maybe that I could join kind of give us a sense of that.
Well, we do have our website, which is a great resource, and it's www.hdassoc.org, which is a great resource. But on top of that, all our professional chapters and all our student chapters do outreach into the community. Mm-hmm. We have those chapters listed on our website. So if you go to our website and there's a link for chapters, professional chapters and student chapters. If you're in one of those cities, you can contact. We have the email addresses for the leadership of those chapters to find out what kind of programs they're doing, if they're doing outreach, if they're speaking at a middle school, if they're speaking at high schools, and that's a good resource to connect. And if there's an opportunity, and if you happen to be in an area that doesn't have a chapter, like we're actually trying to develop a chapter here in the D.C., Virginia area, we'd love for y'all to contact our national office, and we can connect you with one of our volunteer members or one of our supporters.
Excellent, and I know there is a chapter in the University of Maryland in Baltimore. There's a dental school there, so for any Maryland students that are curious about that, you can always get in touch with us here at in the HDA office in Washington D.C. So that's great. Now, what would you say? What do you hope to accomplish in the organization? Coming in, you're new, you're kind of new to all of this dental, professional dentists. What are you thinking of?
I guess there's a level of personal challenge having just moved. I moved myself from Texas to become the executive director, and our organization transitioned from Illinois to D.C. So we're sort of both in that sort of we're in D.C., now get to work kind of mode. My goal for the first year for this organization is really just to position it in a way that we provide those resources that are valuable not only to our partners, but also to members of our community, getting that information out to the broader community. And so we're looking at areas that we don't have a chapter, like we don't have a chapter in Florida. We really want a chapter in Florida because that's a huge Latino population there, but also expanding and strengthening our chapters that are around the country. And so that's my goal, to be part of the chapters, communicate with them, provide them the resource, and then having the community be able to access those resources either through our website or our local chapters.
Excellent. And are there any big events that are kind of coming up? What's sort of your year looking like?
We do have our annual conference every year. This year it'll be in Boston, September 26th through the 28th. Throughout the 2 days of the conference, there's a lot of networking and professional education for individuals who are currently in the oral health profession. However, we do have our exhibit hall, which is open to the general public, so we welcome, there's companies there, there'll be services provided, so we welcome individuals who are in the general vicinity of the Boston area or anybody who wants to travel to Boston to be part of our annual meeting. And we do move it around the country. Last year it was in Florida, and we're hoping to head up west next year.
Very cool.
So that's our major event.
Okay. Now, in the short time that you've been there, what will you say makes it worth it for you to come to work every day, and what keeps you looking forward to it?
Pretty much it's just knowing that we're making a difference. And when we get the numbers from our chapters of how many people they impact and direct services that they've given, I mean, just as an example, in the last 2 months our chapters have actually provided direct services to over 300 Latinos. So that in itself is we're making a difference one Latino at a time. And so that's really what drives me, motivates me, and keeps me here in cold D.C. during these months. No,
thank you. It's exciting. And I think that's often the difference and the opportunity that we get to work with working in a nonprofit environment. I mean, it's different. Obviously you're not going to become rich, but you're going to make a difference, and it's very palpable in a way. So I definitely appreciate that. Now, if somebody was considering, maybe not dentistry, but what about a position of leadership, let's say in nonprofits, in Latino nonprofits? I know there's a lot here in the area, and that's a huge advantage that Latino youth have that live here in Montgomery County and Virginia. So if they want to get involved, if they want to get, maybe not necessarily with HCA, but just in general, these kind of organizations, giving your perspective and hindsight, what would you recommend?
I'd say get involved. I mean, there's so many nonprofits in your community as a whole, but also there's so many nonprofits that are servicing the growing Latino population across the country. So, look at a directory, find out, Google the organization or any organization that you're wanting, Latino, Hispanic, and a phrase of what you want to get involved. all nonprofits also are always looking for volunteers to help drive their mission, and so just
so is HDA, right?
Absolutely, we welcome all volunteers and interns at our Washington D.C. office.
Very cool. Well, David, I'm excited. I'm excited to have you in the community. Obviously we get to work a lot together, so it's great. It's a privilege, and I think that HDA can certainly accomplish a lot for its members, for obviously the Latino community. It appalls me to know that, I mean, like you were saying before, like Latinos often believe that they can brush away cavities. Like that's not true. And so there's a lot of education that needs to take place in the community, but also many, many ways in which we can bring up leaders through the organization, and we're seeing them come up. So I'm grateful for that. I definitely want to encourage you to keep us posted on any new exciting things that HCA is up to, and also just any way we can help you. You guys can find the Hispanic Dental Association on Facebook, on Twitter. Same as us, Generación Latina. We're on Facebook, we're on Twitter, and like I said, guys, anything that you care about, we want to bring it up for discussion. Latino youth here in Montgomery County are making a huge difference, but also nationally. And we're literally in the backyard of many national leaders like David Pena and many others. And so we can get involved in a lot of these causes. We can actually have and make a difference in a lot of these, even national immigration reform just coming up. I mean, this is the time to get involved. So I want to encourage you all to find what it is that you're passionate about, what it is that you care about, and where you'd want, to make a big difference. And maybe not a big difference tomorrow, but in the next 10, 15 years, really, those spots are there for us to take. So to go at it, and I know you can find a lot more information about many organizations online on our website, generacionlatina.org. But again, I welcome your involvement, so stay in touch with us, and thank you again for joining us tonight, and we'll see you next week.